Return demonstration in lifting and carrying emergency nursing.
Before lifting and carrying a patient, first is to survey the scene and safety of the location by checking for personal hazards or personal dangers. Perform hand hygiene. Identify the need and secured appropriate personal protective equipment. Before lifting the patient, assess the client's body size. Determine the client's level of consciousness. Check the number of staff or responder needed to lift the patient and the skills and strengths of the staff responder. Explain the procedure, then instruct each member where they should be positioned.
Direct ground lift, no suspected spinal injury.
Rapidly describe sequence of steps to perform before lifting. 2 or 3 EMS providers line up on one side of the patient. EMS provider knee on one knee, preferably the same knee for all the EMS providers. The EMS provider at the head places one arm under the patient's neck and shoulder while cradling the patient's head, while the second EMS provider places one arm under the patient's knee and other arm just above the patient's buttocks. While the third EMS provider, she should place both arms under the patient's waist and other EMS providers should slide their arms either up to the mid-back or down to the buttocks as appropriate. On signal, the EMS providers lift the patient to their knees and roll the patient toward their chest. On signal, the EMS providers stand and move the patient to the stretcher. To lower the patient, the steps are reversed. Place strongest EMT at head end, then team actions were coordinated.
Log rolling.
Kneel as close to the patient's side as possible. Maintain his or her back straight during the procedure. Leg roll the patient onto his or her side to place a patient on a backboard. Roll the patient without stopping and securing the patient's safety.
Supine transfer, direct carry.
Position the structure perpendicular to the bed with the head end of the structure at the foot of the bed or foot end of the structure at the head of the bed. Both EMS providers stand between bed and stretcher facing the patient. First EMS provider slides arm under patient's neck and cradles patient head and shoulders. Second, EMS provider slides hands under patient's hips and lifts slowly. On signal, patient is lifted and curled toward EMS provider's chest. EMS providers rotate and place patient gently on stretcher. Correctly body mechanism, grips, and devices are integrated in the procedure as needed. Infection control is maintained and safety of patient was prioritized.